Then we have good old diabetes mellitus, DM for short. So with diabetes mellitus, there are two primary types of diabetes: type 1 diabetes, type 2 diabetes, and then we also have our little talked about but very important diabetes called gestational diabetes. Type 1 is genetic, it's autoimmune, or even triggered early in life from a viral infection, really. But essentially, type 1 diabetes is where the cells attack the insulin producing cells in the pancreas. And so now you no longer have the production of insulin. Whereas with type 2 diabetes, because of metabolic changes and lifestyle choices, the body becomes resistant to insulin. So it still produces insulin. It may even decrease the production of insulin. But the key here is because of lifestyle choices, including, for example, hypertension and obesity being a critical one, now the body no longer responds to the insulin that the body produces. In contrast, you have type 1 diabetes where the cells of the pancreas that produce insulin are destroyed. And so they no longer produce insulin. Type 2 diabetes, they do produce it, body doesn't respond to it. Gestational diabetes is critical because it's one of the most prevalent diseases among pregnant women that come with some serious complications in pregnancy. If I'm not mistaken, there's about 15 to 25% of pregnancies worldwide that present with gestational diabetes. So your symptoms are going to be everything related to hyperglycemia. So excessive thirst, fatigue, wounds that heal slowly or not at all, changes in vision, changes in weight, and certainly your glucose levels are going to be high. Note, though, as a nurse, as you're providing care, the provider will make a target blood glucose level for them that likely will not be the same as the normal value or normal range. So make sure as you are monitoring their glucose that you're monitoring it in relation to their baseline and their target blood glucose levels. Typically, especially if they're on insulin, there's a sliding scale that is used as well. You also need to teach the patient or reinforce for the patient how to monitor their glucose levels and making sure they know to call their primary care provider if they have glucose levels that are higher than their target for multiple days or any consecutive readings of 300 milligrams per deciliter or more. Another important thing, of course, patient teaching is teaching them how to use the glucometer and record their results, paying close attention to instances where they may have developed diabetic neuropathy, because that's going to change their ability to do many of their ADLs, but especially their ability to properly monitor their glucose with a self-stick glucometer. So in that particular case, it may be indicated to use a long-term monitoring device that are oftentimes being prescribed now, where they don't have to do the daily sticks or the multiple sticks in a day. There's a device that's placed on their epidermis, and it has a small needle that goes into the subcutaneous tissue, and usually through a device or their cell phone, they can read their blood sugars. So that's going to be something to advocate for with the patient, especially one that is older with neuropathy or impaired vision or any type of disorientation like dementia or lack of support at home, because oftentimes a complication of diabetes is not knowing the blood sugar level and not properly managing intake of insulin and or your anti-glycemic medications. Some critical points here that I'll add is the patient's glucose should be checked once when the patient wakes up, before meals and before going to bed. You're going to increase water intake if the patient has hyperglycemia. Both decreased blood flow to the feet as well as neuropathy occur, and so that ends up having to make the feet something the patient really needs to watch. So they likely are going to need a referral for care with a podiatrist So you're going to also monitor, though, their feet if they're inpatient. Monitor their skin integrity because of the delayed wound healing that is associated with hyperglycemia. Hypoglycemia, really, those high levels of glucose in the blood inhibit the blood vessels' ability to heal at a normal pace. So wounds are hard to heal, have a hard time feeling their feet because of neuropathy. So teach them to check their feet every day. If you're going to apply lotion, a moisturizer like lotion, don't apply it in between their toes because that can result in increased friction and impaired skin integrity. You're going to instruct them to make sure that, of course, hopefully they have an exercise routine. And in that event, they're going to monitor their glucose levels before exercising, while they exercise, and after they exercise. Because that's usually when you see changes in glucose levels and instances where you have hypoglycemia. They do need, of course, to know the signs and symptoms of hypoglycemia and hyperglycemia. So that's a critical part of patient teaching. In terms of administration of insulin, regular insulin, the U100 strength at least, can be administered via IV, particularly IV bolus, IV push. I will also say some short duration insulins like Lispro, Aspart can be used via IV infusion. You want to make sure that you're assessing for lipodystrophy. So looking at their subcutaneous tissue to see if there's any breakdown in tissue where they are not switching up the injection site, any redness, swelling, or irritation, or erythema. And then reinforcing that they need to change their injection site because that can result in tissue damage where the skin integrity is impaired, and of course they're not absorbing the insulin medication. In diabetes, you want to prevent any type of moisture from accumulating anywhere on their body. Like I said earlier, especially when it comes to foot care, which is very important, making sure that when they're bathing or showering, they're drying between their toes. If you or another provider or caretaker or themselves are applying lotion to their feet, making sure that they do not apply them between their toes because that's a instance of moisture. Critical medication tip here in terms of metformin. So metformin needs to be withheld temporarily before and for 48 hours after any radiological study where they're going to get a contrast dye. So a CT scan with contrast, they need to have their metformin withheld before and 48 hours after that imaging study that involves dye. Now, if there's no involvement of intravenous dye, then they're going to take their metformin as normal. But if they're getting any type of radiologic study or imaging that has contrast dye, intravenous contrast dye, then you've got to withhold the metformin before and after. Another key point in terms of medications, insulin glargine cannot be mixed with any other type of insulin. Insulin should never be frozen, should never be kept in direct sunlight, and definitely shouldn't be kept in a hot car. But if a vial of insulin will be used for up to a month, it may be kept at room temperature. So if a vial is going to be used for up to a month, it can be kept at room temperature. Otherwise, the vial of insulin should be refrigerated. Just some key pointers here as it relates to monitoring blood sugar. H1C is really just a reflection of how well blood glucose levels have been controlled for the past 3 or 4 months. Poor glycemic control is essentially one of the biggest complications of diabetes and comes with an increase in H1C levels, A1C levels rather. High serum glucose contributes to osmotic diuresis. So you have the polyuria that is associated as the body's trying to get rid of glucose that's at excess levels. That also puts them at risk for dehydration. Also, a hypoglycemic reaction may occur in response to exercise. So as I said previously, they need to exercise either an hour after meals or an hour after consuming a 10 to 15 gram snack of carbs or liquid carbs. And of course, monitor their glucose before, during, and after exercise, because that's usually when complications occur. Let's see. Insulin should never be stopped. It may need to be increased during times of illness. And the most effective measure for testing blood glucose is to test it before a meal and at bedtime. Doesn't mean you don't test in other times, but that's the most effective measure of it. See, a couple more things I do want to point out. Meals should be approximately the same time each day. That'll help maintain stable blood glucose levels. Any variation of 30 minutes to an hour is not going to be a significant issue, but helping to have stable glucose levels, of course, helps control diabetes better. So having meals around the same time every day does help. But do note that when the client's under stress, including physiological stress like an infection, an increase in the dose of insulin may be required. Of course, that's going to come with a provider order. That's not something a nurse is going to do on their own. But instances of increased stress or infection may require increased insulin dosage. And glucocorticoids should be used with caution in patients with diabetes because they mask the signs of infection and they have sugar.